Hi, everyone. My name is Kate. I am a nurse educator here at Women's Health Network, and I'm really excited that you're joining us today for a conversation about detoxification. Joining us in the conversation today are Dr. Susan Brown. She is a medical anthropologist and clinical nutritionist specializing in bone health, and she's joining us from Syracuse, New York. Hi, Susan.
Hi there. Nice to be with you all.
Yeah, thank you for being here. We also have with us today Dr. Sharon Stills. She is a naturopathic physician, and she's joining us from Tucson, Arizona. Hi, Sharon.
Hi, everyone. Nice to be here.
Thank you for joining us. And finally, we have one of our very own wellness coaches here at Women's Health Network. Wellness coach Marina is joining us from right here in Portland, Maine. Hi, Marina.
Hi, everyone. I apologize. My voice is a little scratchy today, but I'm going to do my best.
Okay, don't worry about it.
Right.
We're glad you're here. So we might as well just get started. I always feel like the new year tends to bring about a lot of discussion about fresh starts and kind of getting our feet back under us from a little overindulgence at the holidays. You know, or people are just wanting to set the stage for some healthier life changes going into the new year. And a lot of the time, these conversations involve detoxification and kind of ways to out with the old and with the new. So I thought it would be an interesting conversation for us to have today. So I think the best thing we can do is start by just defining what it is to detox. What does detox mean? Sharon, why don't you start us off?
Sure. Well, when I think of detox, I think of ridding the body or our lives of things. And so when we're thinking about health, we think about detoxification from the numerous amounts of chemicals and pesticides and metabolic byproducts that are retained in our body that we need to release. But when I'm working with patients, really think of detox on a global level. So it's detoxing from relationships that no longer serving you. It's doing a digital detox of cell phones and emails and Facebook. It's doing a detox just of behaviors that are no longer serving you.
Yeah, I think that's important to acknowledge that we can be toxic in a lot more ways or exposed to toxins in a lot more ways than just, you know, through the things that we're eating or doing. Susan, what would you say are some of the health benefits of removing toxins from the body?
Well, you know, I think to me the operative principle here is that purification leads to progress. And so there's many, many ways we can purify our home environment, our nervous system, our physical body itself, whether we're talking about detoxification through the skin or through the colon or through any other part of the body, through the liver. So to me, the idea is to actually decrease any impediments, any blockages that are keeping the natural flow of intelligence through the body. And so I really think the benefits of detoxification are that they really enliven the body, mostly enliven the healing potential, and increase the flow of energy and the flow of information, the flow of intelligence throughout the entire body. So, yeah, I sum it up. The benefit is purification leads to progress.
Excellent. Did anybody else want to add on to that?
I completely agree. I mean, with a lot of women that we actually talk with, obviously we talk with women who are dealing with hormone imbalance, and there's so many, kind of like what Dr. Stills was saying, there's so many chemicals in our environment that really interfere with that, and part of that detoxification is removing those things so our bodies can function better, but also really focusing in on how our hormones are produced and regulated, things like our thyroid function, and that we can really kind of improve, I think, by focusing in on getting rid of a lot of that stuff that will interfere with it.
Right. Definitely. We do hear that scenario kind of over and over again.
Yeah.
Women that are just struggling hard. So I suspect the answer is kind of all of us, but who can really benefit from a detox program? And kind of the second part of that is, if we have, we have natural detoxifiers, if we have a healthy liver, if we have healthy kidney function, these kinds of things, is it still necessary to take additional steps to detoxify our bodies? Sharon, what do you think about that?
Well, first of all, who can benefit was the question.
Yeah.
So,
yes.
you know, most people can benefit from a detox. One of the important things that I see clinically is really seeing where a patient is at and are they ready to detox. And so there's a lot of buzz out there about detox, and I think it's really important that we make sure that the detox is actually going to not do more harm but actually do good. And so that has to do a lot with preparing the body. And so, as Susan mentioned before, we really want to look at the eliminatory organs, or as I like to refer to them, the emunctories. And so, how is the liver functioning? How is the kidney functioning? How are bowel movements? And so we're looking at, is the lymphatic system flowing? And so sometimes before we even start the actual detox, what's really important is to just make sure the organs are functioning. And we can have standard blood tests where we say, you know, your liver's functioning good, your kidneys are functioning good, but that doesn't necessarily mean that they're up to the challenge of detoxing. So I think it's really important that we prep, we take the right liver herbs, we drink enough water, we make sure we're doing some deep breathing, we check in with our bowel movements, and we make sure that the body's ready to undergo a detox.
Right.
And that's especially true if you have symptoms, like a person might, the people that might have congestion or might have excessive fatigue or might be constipated, some obvious sorts of symptoms that there's toxins really on a very obvious level building up in the body. So that's a great place. Everyone can start at that sort of level. And the deep breathing is interesting because when we breathe deeply, we bring oxygen into the system, and that's one of the primary ways that we detoxify. And we release acids through our breath. So everyone can start at some simple levels. Some individuals, like I deal with individuals who might have heavy metal issues, and that's or have parasite issues or issues that are a little more complicated, and maybe don't pertain to everyone. But certainly all of us can begin with those basic detoxification suggestions that Sharon was going through.
Excellent. Yeah, and things like the deep breathing, you know, we always talk about deep breathing, I feel like mostly in terms of stress relief when we are, you know, talking to the women that we talk to every day here. That, you know, it's kind of something that's designed to reset and calm the mind, but there are so many benefits. You know, we don't often think of deep breathing in terms of the detox or other things. So yeah, these kind of simple practices that we know are beneficial, but don't necessarily even know all the ways that they are initially. You know, just putting basic self-care stuff into place.
Yeah, that's exactly right.
Yeah.
I like to say the breath is the best medicine always, and it's right within us. It's always available, and we need to remember to take advantage of it.
Exactly.
And it's what connects us to life. I mean, and actually breath is a great way to detoxify emotional stress. Like Sharon was suggesting, a lot of the stress, a lot of the toxins we create through our own thought patterns. And if we can use the breath to slow down those thought patterns and actually to create a little distance to become aware, oh, I'm having my pattern of fear is popping up again, and this is a very toxic fear. And they say, well, let me take a few deep breaths. Let me realize I'm not the fear. Let me separate myself from the fear. Let me feel that fear, but then maybe let go of it. So, yeah, breath is, I think we can rank breath right along with water as a great detoxification.
Right.
Agreed.
We could do a whole hangout just about breath.
Whole hangout on breath.
Coming. So in the course of talking with a lot of the women, you know, who we speak with, they engage in, we'll say, all different kinds of detox methods. And so we talk to a lot of women who spend lots and lots of time in saunas, and they are doing colonics, and they're on really restrictive juice fasts and things like that. That I guess I just, you know, you start to wonder what's really beneficial, or what the benefits are, or what we should be avoiding. And I didn't know if each of you wanted to speak to that a little bit. What should we recommend? You know, what do you recommend? What should we avoid? Those kinds of things as far as detox is concerned. Anybody.
I'll jump in and just say that the women, a lot of times when we're talking with them, their motivation for a cleanse or a detoxification is weight loss, and that can sometimes become problematic because the main goal isn't actually detoxification when I think it should be. But I usually like to tell people the first step is maybe removing some of the most prominent offenders. Like, are you doing things on an everyday basis, like, personal care products or some type of chemical that you're in contact with a lot? That sometimes is a good first step to get that stuff out of there, and then worry about more, I guess, involved types of detoxification.
Yeah, I think you can certainly develop a tier system that right off the bat you want to eat as clean food possible. You want to have purified water. You want to make sure that your environment is as clean as possible. You want to make sure that your everyday detoxification procedures, like drinking plenty of water, like making sure you have a good transit time and you aren't any tendency to constipation, eliminating through the skin, and often brushing your skin can be a helpful thing. Those simple things, and then there's a deeper tier when you know that you have serious accumulation of heavy metals or chemicals, and this is where these sauna procedures come in, maybe in enemas and colonics, and all that stuff is really great. And there's very established protocols that your doctor and health practitioner can help you see which ones pertain to your particular case.
Yeah. I'd like to jump in and talk a little bit about the things you mentioned, Kate. So as far as sauna therapy go, I think, as Susan was mentioning, sauna therapy is really effective when you're trying to detox heavy metals and you're trying to get those toxins that are stored in the fat tissue, and making sure that you're using an infrared sauna rather than just a regular sauna that's at the gym can be very beneficial. And it's important to be under a physician's supervision so that you actually are not hurting yourself, that you're not depleting minerals, and that you're replacing what needs to be replaced at the right time. Same goes for colonics. Doing a cleanse at the change of seasons is always a great thing to do. One thing you want to be sure of when you're doing colonics, it's important when you have the colonic that you're cleansing, but it's more important what happens after the colonic, that you're doing an implant and you're replacing the beneficial bacteria that was washed away. And as far as juice fasting goes, I think it can be useful in the appropriate situations. I think that when we're talking about our belief systems, if we're doing a juice cleanse because we want to lose weight and then we're going to go back to our negative behaviors, or we're not coming from the right place, it can be more detrimental and not really positive. I think how we come off the cleanse is often more important than what we do on the cleanse. And so if you're going to do a juice cleanse for 3 days and then go back to crazy eating habits, you're actually going to do more harm to your metabolism. So what we do after the experience is what's most important.
Yeah, I think that's really important to remember, that the cleanse is not, it's an act in and of itself, but it really should be kind of the first step in a bigger routine of healthier habits and better self-care practices. So I know that Marina and Susan, you kind of touched on this already a little bit, but what kind of first steps do you recommend? I think it's really important, like you said, Susan, to be working, and Sharon, to be working with a provider and help to determine whether there are some underlying, what the underlying issues are or where your greatest area of need might be. But for women who just want to start kind of basically an easy, maybe at-home detox program, what kind of recommendations do you have as far as first steps are concerned, or herbs that might be supportive during that time or something like that?
Well, what we do here at the Center for Better Bones is we do an elimination diet, which is a great way to start. You go off the common everyday, not life-supporting things like the coffee, sugar, alcohol, processed food. So you start eating fresh whole food. You maybe even go off gluten if you have kind of weak digestion and you think that's a problem. You certainly go off any food you know you're allergic to, and you eat a fresh whole foods diet with lots of herbs that might purify the blood, like red clover tea or nettles, or nice life-supporting things like that. And then that's a sort of a dietary detoxification. You take extra fibers. You do some probiotics that help to reestablish the intestinal flora. And then, of course, you do the exercise because you want to begin invigorating the body. And you do your little meditation, so try to quiet the mind. So that's actually a great little beginning detox program.
I agree. I was going to add to that too, is looking in your home and in your beauty routine, especially for women. I think those are major, major sources of chemicals we're not used to seeing. Even like our home cleaning products is a major, major source of chemicals in the home. And even just cleaning that up a bit and even making your own or something along those lines can go quite a long way in getting that stuff out of there too.
Yeah, absolutely. I think we don't even recognize sometimes, unless you really go ahead and do the research, you don't even recognize the significant areas of exposure that you got every day. Yeah.
I'll add to that. I think, I do a lot of the similar things with patients that Susan was talking about. I think making sure you're eating organic, so you're not getting any pesticides in your body is a wonderful thing. Avoiding GMO foods, so you're not getting the genetically modified foods. Making sure that when you exercise that you're sweating, because sweating is a great way to release toxins. And as I mentioned to start, just taking stock of what's going on in your life, looking at your relationships, looking at how much time you spend online, and starting to really be honest with yourself about what is negatively impacting you and what's not positively impacting your day, and what are the things you can start to release. And sometimes it also can just be energetically detoxing, just cleaning out the closets, cleaning the house, making your space freer of what's been clogging you, and then it just starts the energetic flow for detox to occur.
Yeah, that's excellent. And those suggestions we often make, like Marina said, I think women often turn to detox as a way to lose weight or start losing weight, but these are the same types of recommendations that we make for women who are kind of floundering with lots and lots of symptoms through perimenopause, women who are struggling with compromised thyroid function or weakened adrenal systems. So really, I mean, this is all, it's great advice, and it's right on par with what we're telling our ladies. So I really appreciate all of you being here today. That's kind of the end of our detox discussion, but I'm looking forward to, we've got more Hangouts coming up, and I'm looking forward to speaking with you all again.
Thank you very much.
Yep.
Thank you. Bye, everyone.
Bye-bye.
Bye.